welcome. Welcome to our first Facebook Live of 2023. Hopefully you can hear us and see us. Pop some comments in the message centre if you can see us okay. Going to have a little check on mine just to see if we're up and running.
Looks like we are.
Lovely.
Yeah, live on there.
Wonderful. So my name's Emma Rigby. I'm the interim deputy head of midwifery at the OUH.
We have no viewers at the moment.
Okay.
We can wait for more viewers if you like.
That's fine. It's going to be recorded though.
That is true. And we've got two
viewers.
Three viewers.
So we'll start again.
Yeah, start again.
Welcome to our first Facebook Live of 2023 and our first Facebook Live for a number of months. We're absolutely delighted to be here. My name is Emma Rigby. I'm the interim deputy head of midwifery.
I'm Wendy Hill and I'm the matron for community and public health.
And I'm Jenna Lark and I'm a team lead out at the Wantage Maternity Unit.
We're here live from the Wantage Maternity Unit, just to answer your questions, to update you with everything that's happened today, and hopefully you'll get lots of information from us. I'm going to be picking up all the questions that are coming in, so get your questions in, ask the experts. If questions come in that maybe we've already covered, I won't go through them. If I feel that maybe they're questions that are going to be better suited for another Facebook chat, then I'll put them on pause, on hold, and we'll bring them up when we have another Facebook chat, maybe with some different teams that would be best placed to answer your questions. So looking forward to getting some questions in, and I'm going to hand over now to Wendy, who's going to update you.
So it is with great pleasure that from today we have officially reopened the Wantage Midwife-led unit and the Chipping Norton Midwife-led unit as well. So from today that means you can come have your baby here, which
Right here.
you're in the lovely pool room at Wantage. You're at Wantage right now. So this is the main pool room. And we're just really, really pleased that we've been able to reopen today and hopefully looking to the future, having lots of more babies born here at Wantage and Chippy.
It's a great day. It's really good.
We're really excited and the teams are really excited as well.
Yeah, everyone has been waiting for this day for a while and we're all just so pleased that we've been able to reopen as a birth centre. Anyone that's come to see us over the last year knows that we've still been working here. We've still been very busy seeing all the women who are pregnant in the area and everyone that's had a baby. But we haven't been open for birth, so it is really lovely to finally be able to announce that news.
So put in the chat any questions you've got about Wantage or Chipping Norton. As we're talking about freestanding midwifery-led units. We're also happy to just talk about Wallingford and the Horton as well, which are very similar. Those two have been open for births this whole time, so it's just Wantage and Chipping Norton that haven't. So that's why we're sort of live from Wantage. But we're happy just to talk about community births in general. And whilst we're waiting for questions, me and Jenna will talk about what happens when you are booked for a birth in one of the freestanding midwifery-led units. Just to explain, freestanding just means that it's not attached to a hospital. Our hospital that is for our trust is the John Radcliffe. So freestanding just means that there isn't a link. The Spires is called alongside midwife-led unit because it's attached, it's in the same hospital. So if you hear the words freestanding MLU, that's what that means. Shall we?
I will let you know if any questions come in, but you go ahead and just give all of the updates, all of the information.
Okay. So we'll start with if you're choosing to give birth here.
Yeah, so we are a midwifery-led unit. We have one room with a pool here at Wantage, and we have another birthing room that we can use if we have more than one woman here. That one doesn't have a pool. In the UK, we very much recommend midwifery-led units to women who are low risk in their pregnancy. Low risk kind of means that you haven't necessarily had any consultant involvement and everything is kind of, we could say, relatively straightforward in your pregnancy. So if you think that you meet that kind of criteria, then you can definitely discuss freestanding midwifery-led unit birth with your midwife. The reason we kind of recommend that as such is there's quite a lot of evidence that suggests that for kind of low-risk women, there's a higher chance of having a vaginal birth in a midwifery-led unit with no extra kind of complications. So we very much base that kind of recommendation off of evidence, really. So if you're interested in birthing here or any of the other midwifery-led units, then the first step would be to speak to your community midwife in any of your antenatal appointments. You can have a discussion with them about the risks and benefits for you particularly of birthing somewhere like this, and they will go through that kind of personally for you. If there was ever a situation where perhaps they weren't sure, or they maybe thought that there was something specifically about yourself that didn't quite maybe fit our initial recommendation, then they can refer you over to our Birth Choices Clinic, who is run by a lovely group of midwives and consultants, and they just have a bit more in-depth chat with you about those kind of risks and benefits, again, particularly for you, because it's all very individualised. And come up with a plan of care that you are happy with, that you understand, and they're really there to kind of listen to you and explain all those kind of bits in a bit more detail. So those are the first steps of kind of having a baby here. If there's anyone watching who is due soon, we very much encourage you to give us a call. So if you're beyond 36 weeks, and thinking you might like to have your baby at Wantage or at Chipping Norton, and that hasn't been part of your plan already, then please do call us kind of sooner rather than later, unless you have a community midwife appointment booked in the next day or two. Do give us a call, and we will arrange a kind of an additional appointment to just start talking about kind of that situation for you. We also have, since reopening, we have a kind of a freestanding midwifery-led unit assessment that we will do kind of in person with you. It's to kind of make sure that a birth here would be suitable, that you kind of understand what it means to have a baby here, and so you can also understand things like transfer times or reasons that we might recommend transferring you up to the JR. So it's very important that we do that before you kind of come in labour. So if you think that is you, then please do give us a call kind of sooner rather than later, so we can get that all booked in and organised, and that won't kind of stop you from having a baby here if you wanted to.
And I think as well, the team are really excited to restart open evenings and tours.
Yeah.
So keep an eye on both the Chipping Norton social media and the Wantage social media. They both have Facebook pages. So they'll, obviously, if you're having appointments, I'll let you know then, but as well, they might advertise it on their Facebook page. And we've traditionally had some really good open evenings at both, where they don't just look at the unit, but they also set up like a home birth room, like a home from home room, and it's sort of everyone's welcome, and just to talk about your different options and also see the unit, especially if you're not having any of your appointments here. Like if your GP is in Abingdon base, or all your appointments have been in Abingdon, this is a really good opportunity to come and see the unit. Or if you're not even under the Abingdon Wantage Midwives, Whitney, for example, this is another opportunity to come over. So we'll restart the tours and open evenings really soon. So just get in touch with the midwife if you are more than 36 weeks but would like to see the unit. And of course you can see the pool room as well while we're here.
And those open evenings are also a really nice opportunity to meet some other midwives.
That was really good timing!
So this is Fran. She is one of the midwives in Wantage. She covers the church group practice in Wantage, and she also covers the Marching Road practice in Abingdon. So if you're registered with one of the GP surgeries, you might have already met her.
Yeah.
So Fran, how are you excited?
I am absolutely amazing. I'm on call tonight, so if anyone wants to be the first baby here, then that would be grand.
Oh yes, we have to celebrate the first baby, won't we?
Definitely.
Yeah.
So remember, I've got a team of experts here waiting to take any questions that you want to put into the chat. So if you want to ask about anything to do with, your birthing in a midwife-led unit, it doesn't have to be Wantage alone, or any queries for these very experienced community midwives, then drop your message into the chat and I can ask the team. So they're going to carry on chatting about what to expect, some of the things that you might find when you come in for a midwife-led unit birth. I'm going to leave them to it, but I'll interrupt if I get any of your questions in.
Fran, do you want to tell us what the process of actually having a baby here is like? Like, who would you call? What actually happens?
Yeah.
Who looks after you?
Yeah, so our telephone calls are, well, overnight they go via Wallingford, so we always talk to women about who to call in different situations. But when women are term, so from 37 weeks, we ask them if it's overnight, because lots of women go and have their babies overnight. It's all to do with their lovely sleep hormones and being relaxed. They often phone Wallingford overnight and they just need to say to Wallingford, I'm planning on having my baby at Wantage or at home, and then Wallingford will contact us as the sort of local known midwives. And then we will speak to them on the phone and make a plan with them. And then if they want to come in and be seen, then we would meet them here. I actually quite often see women in our room next door, and we set the room up without these horrible bright lights on, turn the lights down, make it nice, dim, cosy, all perfect for your hormones. Just get you settled in, because often when you move in labour, things can slow down a little bit, and then we do like a full assessment, so we offer to do maternal observations, offer to do a little baby check as well, and then we just wait and see what's happening with those surges or contractions, and we make a plan from there really. Some women might want an examination, and then we can talk about different options in terms of pain relief as well, so it's very individual. Some women want the gas and air, some women want the pool, so we start running that. I tend to run that quite early if I'm looking after someone here, even if they don't quite want it straight away, just because it's quite a big pool.
It's a lovely big pool.
And it takes about 40 minutes to fill, and I'm so excited to fill it. So that's generally the sort of process. If women did come in a little bit earlier and actually they feel like they don't need to be here, or they just wanted to check and they might go home again, but that's entirely up to them and how they're feeling.
Well, thanks, Fran. I've got the first question coming in.
Right.
So, question from Emma. Do any of the freestanding MLUs support breech birth? Emma's currently hoping for a home birth, but the baby is currently breech. She's 34 weeks and trying to turn him, but wants to understand options too.
So, still got lots of time maybe to turn, which is really good. We've got spinning babies, which I'm sure you've probably already been on, no doubt, to look at all those different positions you can try. At your 36-week scan, assuming you've got one booked, they'll confirm the position of baby. The next step after that, we will refer you to the breech team if baby is still breech. It's called an ECV appointment, which is a type of manoeuvre we use to turn babies. You might not necessarily get an ECV or need an ECV, but that's what the clinic is called. Just a bit of confusion there. But you'll see a specialist midwife and a doctor, and then they'll be able to talk you through your options, including your choices for birth. And if you do want to, if your baby is breech and stay in breech, and you do want to give birth in community, then you'll probably be seen by one of our consultant midwives in birth choices to look at your options there. So, does that answer that question?
I'm hoping.
Yeah.
Want to add anything else? I'm hoping that answers your question, Emma. If you wanted to add anything else, then pop it in the chat.
It's hard to give specific clinical advice without knowing your picture and your history. So I can't give you a very specific answer, but that would be, you'll have options and appointments to discuss it with your team and what's best for you. So I hope you make an informed choice. I can't really give you the information to make the informed choice now.
Yeah.
And it will become clearer at 36 weeks after your scan.
Yeah. And we've got the breech team as well, which are really good at sort of supporting all types of birth breech positions.
Lovely.
Should we do having a pool birth? Let's talk about water as a pain relief. That's a good one. Go on, Fran. You joined us as a guest speaker. Fran's a guest speaker.
About having a pool birth?
Yeah, why water is good for pain
What are
relief.
the benefits?
Yeah.
So water is a great form of pain relief. It's a really good coping strategy. It's a very popular option, especially in our midwife-led units. In terms of benefits, being in water, if you haven't been in water heavily pregnant, it's amazing. Really good weightlessness of the water and really easy to change position, which if you're heavily pregnant watching this, you'll probably know it's a bit slower to move around. So you can still be in what we call upright forward and open positions, so UFO positions for anyone that's been doing any hypnobirthing. so you can still get in all those different positions in the pool. I also think it's a really nice sort of mark of your space as well. So you have this sort of very defined space that is yours, which can be really lovely. And we've got a really nice wide edge to this pool as well, so often lots of women are sort of leaning on the edge of the pool, and partners can hold hands and stroke hair, and it's just really beautiful. We have a little stool, and we just try and sit out of the way, and we're just there if you need us, really. But it's really beautiful to watch people in labour and their partners looking after them. And then babies can be born in the water and underwater, because babies go from one watery environment to the next. So for the babies themselves, it's really calming. Often babies come out really quiet and chilled, which can be really, really normal. And it's just really lovely, and women can catch their own babies and bring them to the surface as well. We don't need to do anything technical, we're just there if you need us, but otherwise we're there to support physiological birth.
And we've had birth partners in the pool before, haven't we?
We have. We do ask for them to wear speedos or shorts, but yeah, it's big enough for two, definitely.
It is.
Thanks, Fran. We've had a response from Emma just saying brilliant, thank you. So hopefully we've covered everything there for her. That's great.
So should we talk about what happens after you've had your baby?
Yeah, I can do that. I feel like mine's been put on the spot a bit. So at us here at Wantage, if you were to have your baby in our lovely pool, in the pool room, or maybe on the bed just outside of the pool, we would obviously be really supportive of things like delayed core clamping and immediate skin to skin. If you're in the pool, we would slowly, gently get you out of the pool when you're ready. Obviously then you've got to birth your placenta, and we support different ways of doing that. Once we've checked you over, made sure that you're feeling alright, made sure that baby's feeling alright, we can move you through to our lovely little ward room, which gives you a bit more space. There's a nice bit of a comfier bed for them sleeping in, made up down there. We've got some cots for your baby. We have support workers who are here to kind of help you with feeding. If you wanted to breastfeed, they can support you with that. Or if you've bought bottles, they can support you to give those first ones to your baby. And then we kind of just set about pottering, really. We start doing our paperwork, we start doing a bit of cleaning, and then once you're feeling kind of well and kind of happy and contented, and we know that you and your baby are both feeling well, then it's kind of up to you when you want to go home. We don't, in a sense, have inpatients here. We wouldn't kind of like bed you down for overnight, but we very much are not moving you out as soon as you've had your baby. There is plenty of time to get confident with feeding your baby, to make sure you're feeling well, to make sure you've asked us all the questions you might have before you go home. And then once you are feeling well to go and you're kind of ready, we'll just get you ready and kind of send you on your way. We'll obviously then, as we would if you were coming out of any hospital or having a home birth, we would come out and visit you the next day, and we're there to answer any questions that might have cropped up since you came home. And we're always here every day on the phone in that postnatal period, because it can be quite, you have a lovely birth and then you're riding high on that adrenaline, and then sometimes things crop up that you might want some more support with, like feeding, and we're always here to help with those. So you can always give us a call, even if you're not booked in for a visit or anything, for extra support with any of that.
We've had a few more viewers, so just to say again, today on the 9th of January, very pleased to announce we have reopened the Wantage Midwife-led unit and the Chipping Norton Midwife-led unit, also called the Cotswold Birth Centre. We're here live from Wantage to celebrate, to discuss all types of community births, but if anyone's got any specific questions about us reopening and what that means and how to sort of book yourself in for a birth here if that's what you wanted, please put your questions in the chat. But we're just really excited. It's a day of celebration for us. We've got cake and everything in true midwife style. We are celebrating with cake.
Yeah.
It's like Call the Midwife Days. but we haven't got any bikes.
Yeah.
I'll see if there's any other midwives
Yeah.
free to
Yeah,
thank
thank
you.
you.
So we've had just a couple of comments rather than questions. So from Little Beans Hypnobirthing, we've got this is fantastic news. And from Victoria, fab news for everybody.
Yeah,
So it's
we're
a
really
positive.
excited.
Yeah.
We've worked really hard. I think Jenna is the team lead here at Wantage and Zoe is the team lead at Chippy. And with them and the leadership team in maternity, the trust executive team, just had loads of people behind the scenes working really hard the last few months looking at everything that we can do and to make it safe. I'm just so proud that we're part of the team in maternity. It's a wonderful team to work in, and I think everyone's worked really, really hard to make this happen. And it doesn't, because we've announced it only sort of today and Friday, it doesn't show all the work that went on behind the scenes. And I'm just, really happy that we got to this day. And we just want to make sure that it's a really safe service, and that women have the choice that they deserve, and that we can make sure that we can facilitate a positive birth experience and choice of birth.
Absolutely.
Yeah,
Absolutely.
so we got there in the end.
So I think it's worthwhile talking about when somebody, so when they first come in, so they may feel that they may be in labour, and what would happen, what to expect, what things would happen here at the MLU.
So initially, like if you were birthing on spires or on delivery suite or a home birth, you would call us, and the best way to get hold of us during the day is by calling Wantage directly, or Chippy directly during the day, and then overnight the service is completely run by the Wallingford MLU. So your midwife will go through all of those numbers. They're in the front of your blue notes. So make sure you've got them down on your phone.
And then the sheet as well at 36
Yes.
weeks will have the numbers on.
Yeah, exactly. So the kind of assessment form that you fill in with your midwife at that 36-week appointment, or for any women who might be a bit past that but still want to have a baby here, we'll be doing in the next week or so, that will have the numbers on it as well. So you would call them directly when either you think you're in established labour, so when contractions are coming strong and regularly, and they will call you back, assess you over the phone, have a discussion with you, see how you're doing generally, how you're coping with the contractions or surges, and just generally gauge how things are going. They would then make a plan with you, whether that plan was to kind of meet you here or at Chippy, or whether that plan was for you to stay home for a bit and call us back a bit later if anything changes. Kind of depends on the situation. If the plan was to come in, they would meet you here. Depending on who the on-call midwife is, so all our midwives live all over kind of the Southern Vale, so they tend to say meet you there in half an hour, something like that. On your arrival you'll be greeted by a midwife and a support worker. They will show you in and kind of settle you down in one of our rooms, make sure that journey in, the kind of stress of getting here hasn't knocked any contractions off, make sure we get all your oxytocin flowing again, introduce ourselves, make sure you feel comfortable with us, and then we would start offering kind of things like doing some observations, having a feel of your tummy, seeing what position your baby's in, maybe having a listen into your baby, and then potentially if your contractions are coming strong and regularly, the midwife might offer you a vaginal examination. Again, things like that are totally your choice. It's completely up to you if you want to have a vaginal examination or not. We sometimes recommend them if we kind of want to gauge what's happening with your baby or where you are in labour, but it's very much a discussion to have with your midwife. Occasionally they might be more strongly recommended than others, but again that's very much situation based. And then if we felt like you were in established labour, and if you felt like you were in established labour, we might sort about filling the pool, getting you into the pool, bringing out some gas and air if you wanted some gas and air, and kind of generally start caring for you in labour. As it approaches the time for your baby to be born, so when you're getting to the second stage of labour, the pushing stage, your midwife would call for a second midwife to come and support as well. We always have 2 midwives here for that kind of birthing part of labour, just to provide that bit of extra support if we needed it. So you can kind of rest easy that there's always an extra pair of hands around when you're going to be having your baby. So they would come, you might not even notice they're here, they'll be in a different room, so you might not even ever meet them. They might only come in if the first midwife felt like she needed a bit of extra support. And then things that we would kind of actively do in labour, or we would recommend that you had in labour whilst you're here. We like to check your blood pressure and your pulse and things quite regularly, and your temperature, just to make sure that we're not seeing any signs of infection or any high blood pressures. When you're in the first stage of labour, we recommend listening into your baby every 15 minutes, and we do that with the handheld Doppler that you might have had in clinic when you've seen your midwife for your checks. We can do that in the pool. You don't have to get out of the pool. We have waterproof versions of them. The midwife might ask you to move a little bit, just so they can pick the baby's heart rate up easier, because sometimes some of the weird and wonderful positions we have to get into to reach the place where your baby's heartbeat is. And then again, we would be kind of offering vaginal examinations more or less every 4 hours. Again, as I said earlier, that's a choice and a discussion for you to have with your midwife at the time. And then I think we've talked through what would happen after you've had your baby. I'm getting to hear that again, but so yeah, that's a bit of a rundown of what it might look like to if you thought you were going into labour over the next few weeks and months and wanted to have your baby here.
Thanks, Jenna.
We can just touch on transfers.
Yeah.
Briefly.
Lovely.
So sometimes during your labour or after you've had your baby in community, you might need to transfer into the hospital. What midwives are really, really good at is spotting sort of early signs that your birth might not be going as planned. And when they sort of see those signs happening, they will have a chat with you. And in most cases, we can spot it before it becomes an emergency. So we're able to sort of recommend different courses of action. And if we do recommend that you need to transfer, we will then arrange an ambulance. We have a special line for healthcare professionals that we call, so we don't call 999, we call a separate number that only midwives or any other healthcare professional can use. And hopefully before you've got to this point, when you're sort of planning a community birth, your midwife would have given you an idea of the ambulance waiting times at the moment. So we get an updated report from South Central Ambulance Service, also called SCAR. So they're the ones who cover all of Oxfordshire, and they give us a report every quarter about the time it takes for an ambulance to get from where they are to the unit or your postcode, and then the time it takes them to get from your postcode to the John Radcliffe Hospital. And so you'll sort of have an idea anyway, and your midwife will have an idea. She'll be able to sort of convey the urgency of the call on the phone, and that the call will be categorised. And then your midwife will accompany you in the ambulance to the hospital. There'll be probably a bit of time at the unit or at your home where we spend some time with the paramedic crew just making sure that it's safe to go. Sometimes if your baby is actually going to be born quite quickly, it wouldn't be safe to transfer you. It'd be safer to have your baby where you are and then transfer afterwards. So it might be that the paramedic crew arrive, but you don't actually leave. They're just there as extra pair of hands. What else about transfers? We phone ahead, so you'll be expected, and you'll have your midwife with you the whole time as well.
Yeah, so the midwife that's been looking after you, that you've probably got to know, is there to support you on the way in, to answer any questions you have. She'll keep you updated on kind of reason why we're moving, what we're going to do, how we're going to do it. And then when you get to it's normally we transfer to the delivery suite at the JR. There'll be a room waiting for us. We'll all go in together, and that midwife will kind of settle you into that room. Occasionally that midwife can stay with you, occasionally she might hand over to another midwife. That will kind of depend on the situation, but they're very much not going to just drop you there and then run away. They will make sure that you feel confident and kind of settled in, and you know what the plan is and what's happening and the reasons why we'd recommend that you transfer. So, you know, as Wendy said, our midwives are very good at spotting reasons kind of earlier rather than later, and they will be talking to you about those preemptively. If they see any of the signs that they might start recommending that, they're going to start talking to you about that earlier rather than springing on you. So yeah.
Okay. Excellent. So we've got a few more people joining us, and it's difficult to know whether they're the same people coming back or if they're dropping in and out. But I think it's probably worthwhile, halfway through our first Facebook Live, is just going over some of the information key information that has been given. And Wendy or Jenna, would you like to make the announcement again?
Well, Jenna, I've done it twice now.
Yeah, so everybody that's joined us, or sorry if we've repeated this like 3 times for you.
It's worth repeating.
Yeah, it is. The Wantage and Chipping Norton midwifery-led units are now open for births again, which is something we're very excited to be able to share. It's something we've been working towards for a long time, and we're now so happy to be able to say that we can kind of safely open these units, so they are there to support women's choice, and to do that in kind of an appropriate and safe way, which is what we've been working towards for a long time, because that was kind of the most important thing, is to be able to provide that safe service for all the pregnant women out there and their babies.
And on that note as well, there are going to be times where we have to face difficult decisions on a very temporary basis, sort of on a rolling night by night, but we just want to reassure you that your safety, your baby's safety, is always going to be our priority. So we'll never make these decisions lightly, and it's always very temporary. Our focus now is on providing a full service with a much higher number of midwives, which we're really happy to announce, and hopefully just giving you that another level of choice that we haven't been able to offer in the last 18 months. But it was always with safety in mind, and we do feel we are now in a better place to provide a full, safe service. But it's not to say that there are going to be times where sickness is high for whatever reason. Is that fair?
I think that's really fair. Or maybe if we've got 3 or 4 births happening out in the community,
a full
maybe
moon.
at homes, a full moon,
Yeah.
and we've got a number of home births going on, and deliveries and births happening in other midwife-led units, we maybe don't have enough staff with that amount of work already happening to be able to keep all units open. But we very much manage that sort of hour by hour, keep our eye on it at all times, whether it's the middle of the night or middle of the day, and try and do offer the, as Wendy said, the safest service that we can at all times.
I think it's important to say in those situations as well, we would always try and offer you the closest we could get to the birth environment that you were planning. So, for instance, if you were hoping to have your baby here, we would look at if Wallingford could support it, and if Wallingford couldn't support it, then could Aspire support you? So we very much try and get you the kind of the best, safest option that we can for you. We don't just go blanket, sorry, no, we can't support that. So yeah, it's a very individual thing, and it's something that our kind of managers when they're on call really look at and really do try and strive to make sure that everyone gets the kind of birthplace that they would have planned for.
Yeah,
Right.
that's always our first priority.
Absolutely. So Holly has popped a little message to us just saying hi and great news about the opening of Wantage. I think we're getting a lot of comments and messages up on social media with these posts popping up.
We love seeing the social media. We love seeing the interaction. Me and Jenna, well, no shame, we've been monitoring it all morning and just been enjoying watching all the comments come through. And then the MVP have posted on this page. The Trust have posted on their official Facebook page. Each unit has posted. I've tweeted from the maternity Twitter page. It's just really nice seeing all the engagement and how much this means to the community. I think that has made all the hard work really, really worth it. Is seeing that community engagement.
Oh.
We have another guest.
So this is our lovely Ida. She is one of the midwives here at Wantage. She covers the White Horse medical practice out in Farringdon. So if you live in Farringdon, you've probably met Ida. And she is one of our very experienced midwives who loves caring for women in labour here. So can you just tell us a bit about
What you love about MLU?
Yeah.
The word love.
Yeah.
Oh gosh,
Yeah.
yes. To be honest, the birth centre here in Wantage was the main reason why I applied for this job. So I'm ecstatic that it's reopened again. And yes, I've had quite a few of mums in Farringdon asking when we're reopening, so I will be now telling everyone. I actually want to text everyone just to say we're opened. So we just love supporting natural births, the home away from home environment, because that's pretty much what, for me, midwifery is about, is just supporting normality as much as we can.
Yeah, lovely. Yeah, thank you so much.
You have to publicise it to the world. So share all those social media posts. Tell all your friends.
Yeah.
We've lost, it's because it's been the length of time, it's 17 and a half, 18 months. Oh, another guest.
Hello.
Another guest!
Hello.
So this is Lorraine. She
Hi.
is a very experienced midwife who has joined us from the Reading Home Birth team. So she is very much in support of all community births and has a huge wealth of knowledge to do with everything community birth wise. Can you just tell us a little bit about why you love births in MLUs or home births?
Oh, I love them because they're lovely low risk experience, and I think it's really lovely that women can just be in their own zone without all those noises and all that noise that you get from the labour suite and all the women meowing down the corridor. And you get that one-to-one experience with the midwife as well. They're less likely to be pulled away to look after other women, so you get that real continuity with us. And that's what's important.
Yes, you are more likely to have met your midwife if you plan a community birth. That's not to say you won't know the midwife in the hospital, because we do have midwives who do very short rotations in between community and hospital. So there is a chance, and we do try and sort of ask on delivery suite, does anyone work from this team? But you are more likely to know your midwife in labour if you plan on giving birth in community, just because of the way we cover the on-calls. Any advice you have for women planning an MLU birth?
Get booking.
Yeah.
Yes, give us a call and come and see.
Yeah.
Absolutely.
Yeah.
Come and have a tour. That's
Yeah.
the best thing, is get a feel for a unit, because sometimes you want to feel safe and comfortable where you are. So come and meet us. We'll meet you. Come and see if it's for you, really.
Yeah, that's a great tip.
Absolutely. What have we said about tours before?
Well, briefly, but touch on it.
So, as Lorraine said, we are more than happy to support tours here. So, some women might have been here before. We do most of our booking appointments from here, but maybe when you came here we weren't open, so you might not have even kind of crossed your mind that you could have your baby here. So if you've been here before, if you don't come here regularly, or if you're maybe from one of the surgeries over in Abingdon, then we'd be more than happy to support you to kind of have a tour here. We can either just support a tour, or if you speak to your midwife, they might be able to support having one of your appointments here. We do also offer, one of our support workers offers aromatherapy massage, which is incredible. She's given me one before and it was amazing. So it is the most calming and relaxing thing in the world. So if you wanted to come over, have a tour and have a massage, then that might be a lovely day out.
Also great to use in labour as well. Aromatherapy has some really good properties, particularly for pain relief. I've done a course in integrated therapy, so I am up with all forms of aromatherapy and reflexology and moxibustion and everything else.
We have lots of different aromatherapy oils here, so you don't necessarily need to bring your own. We have diffusers and things and everything raring to go. So we can kind of individualise that to you when you're here in labour. Definitely.
Is there anything that women should bring in, particularly when they're coming in for an MLU birth?
I think it's really good to bring in those battery operated candles.
Yeah.
And if they want to put, some that lights up or something, I don't know how we work
on
with
choice
that.
of music
We've
as
got,
well.
making it an environment what you want it to be is quite important.
We've got a wireless speaker that you can plug your phone to connect to, so you can play your own choice of music.
Yeah, just make sure you can connect to a Bluetooth speaker.
And it's
and
a
if you
really
can't,
silly
then get your own.
thing. I always say to women, bring your own pillow from home,
Yeah,
because it
that's a
smells
good
of
one.
home,
Yeah.
so it makes you feel comfortable.
Yeah.
Yeah.
That is a really good one. The pillows here, and I love the NHS. but maybe
NHS pillows.
pillows are not our strong point.
No,
Your
we don't
own
do
pillow
pillows well.
smells of home, so it has that comfort feel to it
Yeah.
as well.
Yeah,
And who can come in with women if they're labouring? Who can come in these days with the women?
so it's the same across the whole trust. So you'd have your initial birthing partner, and we're allowing up to two birthing partners in labour. So that is your choice of whoever that might be for you. It might be your partner. It might be some women bring their mums. Some women bring doulas. Some women don't have their partners and they just have their mum and their sister. So yeah, completely your choice. The only limit is that two birth partners per person, per labouring person.
Lovely. And while I've got 4 of you in the room, here's a little thing. What would be your best bit of advice you'd give to a woman looking forward to having her baby here in an MLU? Or actually just looking forward to having her baby?
Yeah, so it's not specific to MLU births. It's don't tell anyone when you've had your baby for at least a couple of hours. There's a bubble that you're in where no one else in the world, apart from the 3 of you, so your partner and your baby, and then whoever looked after you, knows that you've had a baby, and that you'll never get that moment back. So you'll never be able to not tell people. Once they know, they know. Then you start getting all the WhatsApp messages and the FaceTimes and the calls, and it's great, as lovely as it is, and your family will be so excited for you. There's a magic in the middle of the night where no one else in the world knows you've had your baby, and it's just the 3 of you bonding, and your phone isn't being lit up. No one's harassing you. And to extend on that as well, if you can, don't even tell anyone you're going into hospital in labour.
Yeah.
So your phone isn't going off. I did have my favourite story is I had a woman who really didn't want anyone to know she was in labour. So during between her contractions, she went on her phone, opened Facebook, and was just liking random posts to make it look like she was just like on social media, right? So she's like, I'll like that, and so that no one was, because she was really overdue as well. So no one was sort of saying to her, "Oh, why have you not had your baby yet? Are you in labour yet?" Because she was liking stuff on Facebook, so you couldn't tell she was actually about to give birth. Yeah, about an hour later she had the baby as well.
Very clever.
Yeah, and then no one knew. So, and then she wasn't questioned. That's my top tip.
So Holly had actually just popped onto the chat how many birth partners can women have at Wantage. So I think we've confirmed all of that.
Yeah.
That you can have 2. 2.
Yeah.
So who else has got a bit of advice with all of your experience? And so just thinking about women having their baby, whether it's at an MLU or home or in the JR.
There's so many different areas that we could touch on, and I think when we're in the clinic with women, we go through so many different bits of information. One of the biggest things we tend to see when women are approaching their due date is very much a stress about the due date and when the baby is going to come and arrive, and that can sometimes consume the last few weeks of your pregnancy. So one thing that I kind of really feel passionately is to try, and I know it's very hard, it's very easy for me to say this, but to try and just put that due date out of your head. It is a meaningless number to you. It might mean something to us from a medical perspective, but for you it really doesn't mean anything. The majority of babies are born after 40+4, so there's only a small number of babies will be born kind of before the due date or around the due date. The vast majority of them are born after that point. So ignore the due date, keep yourself busy as much as you can, rest, enjoy yourself, book things in, book lovely things in that you enjoy doing. Don't just sit at home bouncing on a ball waiting for contractions to start, because that's possibly going to put you completely off.
Yes, and on the booking thing, I think that's one of the main things as well. Very often I get mum saying, "Oh, I was sat at home waiting for the last 2 weeks, but I've decided to book this because it's my friend's birthday and I had to go into labour today." Those things you don't want to miss. That's when you're more likely to go into labour than when you sat at home waiting.
Yeah,
So,
exactly.
when you actually want to let your head down, relax. That's one of the biggest things as well. Because relax as you can.
Is key.
I always encourage mums to also watch like comedy movies or rom-coms, anything that gets you just
Not
relaxed, happy, all those feel-good hormones will help you.
Yeah, absolutely.
Anyone?
I always think, hunkering down in the evenings is really important, because that's when the body starts to have an increase in oxytocin, the hormone that makes you contract. So you don't want to be, stressed at that time, because you're going to fight and flight, and that stops the contractions. So you want to get into a really, really, really nice place. Cuddling up with your partner, as Ida says, watching a really soppy movie, something that really gets the tears going, because we know that oxytocin is going to continue increasing throughout the night, and hopefully you will tip over the edge and go into labour.
Thank you. I think mine would be never be afraid to ask anything, and that goes throughout the whole pregnancy, but of course while you're labouring. We've probably heard most questions before. We've probably asked them ourselves. No question is ever a daft question, and so always ask. If that question's in your mind, just ask it. Never be afraid to ask.
Definitely. And I just want to also add as well, all of this applies to any type of birth you're having. I know that our focus today, for obvious reasons, is on midwife-led unit births, but even if you're having an elective cesarean, all of this stuff is really important as well. So if you're planning an elective, the night before, do have a little date night. Enjoy that moment. It's still going to be really important that you go in the next morning to plan surgery, feeling relaxed, feeling happy, not feeling scared.
Definitely.
So all these tips, you can apply them to every type of birth. If you've had a cesarean, the magic bubble you're still in still applies. You'll be on recovery, but you still don't need to tell everyone. You can still just spend the three of you in that recovery bay after you've had your cesarean, just enjoying that moment. You don't need to have given birth outside of the hospital to still have that magic.
Yes,
Absolutely.
definitely.
Yeah,
100%.
absolutely.
Magic can still be there whatever way you do it.
Yeah.
So we've got just a short bit of time left now. So for the 15 people that are watching, I know there's some of our colleagues watching.
It's mostly midwife watching.
But if there is anybody there that would like to ask a question from this team of experts, if you want to pop it into the chat, we can ask, we can share, because probably if you've got that question, most other people are wanting to know the answer to it as well. So short little bit of time left on this chat. We're going to be running these Facebook Live events every 2 weeks, always at 12 o'clock on a Monday. We're going to do them from different areas and with different teams of experts. But if you and you can watch them back, you can share them with your friends. You can make us go viral. You know.
I'm so ready to be viral.
I think we'd have to do something spectacular.
Quite spectacular anyway.
We could do the charge house slide. That's a really important one. For
Yeah.
ladies.
All in good time. So if you do, and we've had Trudy comment that it's just great news that the MLUs.
Lovely Trudy. We missed you, Trudy. Just to reiterate, we have reopened. I think it's the 4th time we've said it
Yeah.
now.
Every 15 minutes. That's good, because we've got potentially a different audience.
And actually, I don't know if you covered it because I wasn't listening. But just in case, you don't need to be booked to have a baby here. You know, we opened now, so if you, as far as I understand that, if you go into labour today and you would like to be here and you meet the criteria, then call us.
Yeah.
Because we have women that are due today or have been due recently, and we had no idea about it, so we couldn't tell you we're opening, but you can still be cared for here.
Yeah.
So it's not that it had to be booked in advance or anything.
Just call regardless. If you are term or 37 weeks or even close to 37 and you've already had your 36-week appointment and you'd like to give her, the best thing is just to call.
Yeah.
And we can just talk it through with you to make sure you've got all the information.
Yeah.
And we've cleared the diaries today,
Yeah.
hoping that lots of women would call us at both units as soon as they saw the news. So we've got midwives waiting to take your call.
And so Rebecca has just popped a post on saying she's just so pleased for us,
Likewise.
which is great, and
We're pleased for the women.
yeah.
We've had, it's been really nice, we've had lots of women sharing that they've had their baby here.
Yeah, they recognise the pool from the
Yeah,
photos.
recognise the pool. So it's been really lovely to hear from women who've had their babies here in the past and who are just pleased for all the other kind of pregnant women in the area that they can have this as an option now.
Word of mouth now, I think.
Yeah, absolutely. I think we've stunned everybody into sort of speechlessness on the chat. Is there anything else that you feel that we should that we haven't gone through yet?
I don't think so. I think the main important points are if you are considering having your baby here and you're past 36 weeks, give us a call. If you are before 36 weeks, then start talking to your midwife, your community midwife, about it in those appointments. Your just kind of general antenatal checks. Look out for tours. I mean, you can book in for a tour whenever. You can give us a call, and look out for open evening details, because we will be starting to run them soon. We just need to get some dates in when we've got kind of lots of staff around for you to meet. So you can start meeting all the different kind of team members, all the different midwives that might be looking after you in labour, and you can save your tour till then if you wanted to have a little nosy round then. It can be a little bit better to wait for an open evening, just because sometimes when you come for a tour we might have someone, we might have appointments going on, or someone in labour, but I mean hopefully when we do a tour we won't have someone in labour, but it might happen. I think it's happened once when we used to do open evenings, but the majority of the time we've managed to run a whole open evening without anyone going into labour.
Both MLUs have their own Facebook page.
Yes, so if you're interested in having your baby here or just in general, you can follow us on Facebook.
Wantage Midwife Led Unit,
Wantage Midwife Led Unit,
I think,
yeah.
and
Or
Chipping
Wantage
Norton,
Maternity Unit,
Chipping Norton Birth Centre, or Cotswold Birth Centre
Yeah.
on Facebook.
Yeah,
And just ask your midwife.
yes.
Yeah.
We'll just ask you midwife. Yeah.
Absolutely.
Yeah.
Okay.
So I think we can probably draw this to a close, unless there's any last minute questions coming in. But hopefully we've given all the information that you wanted to hear, and you've been able to join us with the celebration of the reopening of these of our midwife units.
We're going to have our cake now.
Yeah.
To celebrate.
We're going to go be proper midwives and drink tea. And
Yeah, that's all we do.
none of this official actual work.
Right, it's no different than an artist's house, is it?
And now, call the midwife.
Yeah.
Absolutely.
Thank you so much for your time in watching, and we'll see you again in 2 weeks' time.
Bye-bye.
Bye.